what I have been taking up. So today's I'll be discussing about one of the very important drug, that is the drugs acting on the reproductive system. So out of the drugs what are acting on the reproductive system, today I'll be discussing about testosterone. So as you all might be very well aware that testosterone, it is the male sex hormone, and this testosterone, it is a naturally occurring steroid hormone. So when looking at this testosterone, this it is a principal endogenous androgen, and since this is an androgen, this is responsible for the, it is very important for the male secondary sexual characters. Since it is an androgen, it is responsible for masculinity. So it is the principal endogenous androgen, which is being synthesized in the body, and the mechanism of action of this testosterone is that it exerts its action by the androgenic effects and the anabolic effects. So when we look at the androgenic effects, what are androgenic effects? The effects what are produced in the body as a result of this hormone, which leads to the masculinization as well as the features, the typical peculiar characteristics what can be attributed to a particular male character. So that is the androgenic effect of testosterone. And what are the basic characteristics, what are the primary sexual characteristics, what are the secondary sexual characteristics of males? So this is exerted by the androgenic effect of testosterone. And when we look at the anabolic effects, so while looking at the anabolic effects, means anabolism means simply it is a constructive process, and once it is a constructive process, it actually refers to that this testosterone hormone is going to increase or gain in the muscle as well as the bone mass. So in males, in boys and men, this testosterone hormone is responsible for the increase in the muscle mass as well as the bone mass. So when looking at the indications, so what are the conditions where testosterone hormone is to be given to an individual particularly? So in conditions of hypogonadism, so it has been found that certain males, certain individuals, their genitals are not that developed as it should be in according to their body and personality. So once the gonads are of a smaller size, so in such conditions of hypogonadism, where the gonads or the genital organs are smaller, this testosterone hormone can be given. Apart from this, in conditions of organic impotence. So what is organic impotence? Organic impotence refers to that the erection what is there in a male, that erection is not sufficient enough to get an intercourse, or that erection is not maintained so that the ideal intercourse procedure can happen. So the failure to get an erection at the time of the sexual intercourse, or the failure to sustain an erection so that the actual intercourse can happen, so that condition is called as organic impotence. And in such conditions, this testosterone hormone, it is the drug of choice. Now in cases of delayed puberty, so there are certain boys, there are certain younger boys, it has been seen that puberty comes very late. So in such conditions, this testosterone hormone can be administered. Apart from this, another case, it is in cases of premature senility. So there are certain males, there are certain individuals where their aging starts much at a younger age as compared to the same age group of their peers. So in such conditions, in conditions of premature senility, means they are getting older very quickly, their aging process is hastened up. So in conditions where aging is rapid, so in conditions of premature senility where the aging process is happening quite rapidly, this testosterone hormone is the drug of choice. in conditions of meropathica hemorrhagia. So there are certain women who experience this meropathica hemorrhagia. Hemorrhagia, you might be very well aware that this is a kind of a blood loss. And meropathica hemorrhagia, it is a kind of an ovulatory disorder of irregular menstrual bleeding due to hyperproliferation of the endometrial cells of the uterus. So this irregular menstrual bleeding due to anovulate is an anovulatory disorder. So in conditions of meropathica hemorrhagia, women are given testosterone. Apart from this, menorrhea, in conditions of menorrhea,